conversion, metric, and household systems. This is important because if you're asked to track the patient's intake or output, for example, the patient's likely to report their intake in cups or other household units, such as fluid ounces, teaspoons, or tablespoons. So let's practice this conversion together. So reading the question, it says calculate the total fluid intake in milliliters for 24 hours. So I like to take a look at the patient's overall intake for the day to make sure that I'm calculating it correctly. So then I divide it into the time of the day to make the math easier to follow. So for breakfast is 8 plus 6 plus 4. That's going to give me 18 ounces. Then for lunch, a patient had 8 plus 10 plus 4. That's going to give us 22 fluid ounces. Next, the patient had 8 plus 6 plus 6. That's going to be 20 ounces. And then for snack, patient at 5 plus 12 plus 4, that will be 21 ounces. So then I take all that and I add it all together. But before I do that, I go through every single item to make sure the milk, orange juice, water, everything is correct. That I'm not adding anything that's a solid or iced, because they should be calculated at only 50% of iced products because it's going to melt and becomes less. So 18 plus 22 plus 20 plus 21, it's going to give me 81 ounces. So the conversion for fluid ounces to milliliters, I know 1 fluid ounce equals to 30 mLs. So then I'm going to take 81 and I'm going to multiply that by 30, which is going to give me 2,430 milliliters. And that's all. That's your final answer. Good luck.